I'm Jeff Goringer, Director of Strategic Communications and National Partnerships here at America's Blood Centers. We are the Association of Independent Blood Centers that bring in 60% of America's blood supply. And we are proud to be partners with Health Professionals Week. And as we have this time dedicated exclusively to LGBT issues, we wanted to take a moment and talk about blood donation in the LGBT community, specifically about blood donation from men who have sex with other men. There's a lot of questions about why a deferral remains in place today. A deferral is being ruled ineligible from being able to donate blood. So we wanted to talk to you today about the history on these issues and the changes that could be on the horizon. So the first thing you need to know is that the United States is unique when it comes to blood donation. Unlike many other countries, we do not have one nationalized blood donation government program. We have blood centers all over the country. We have independent community blood centers, members of ABC, we have the Red Cross, and we have a small amount of hospital blood donation programs, all of which are regulated by the FDA. And so when it comes to men who have sex with other men, the decisions on eligibility are made by the FDA. And in 1983, the FDA initiated guidance that put in place a lifetime deferral on blood donations from men who have sex with other men. Now, you got to remember around this time in the early 1980s, testing on things like HIV was really non existent. And the perception of this policy, as time went on, especially, was perceived by the gay community as inconsistent because men who have sex with other men were permanently deferred from ever donating blood, while other individuals who also had HIV risks were deferred for just 1 year after their exposure. And this inconsistency has led to advocacy groups, many of them campus based in colleges all over the country, protesting that lifetime deferral policy. Now, you may be wondering about that inconsistency. Why are gay and bisexual men deferred from donating blood when gay and bisexual women are not? Well, the FDA based its decision on CDC data, which found that gay and bisexual men have the highest risk of HIV infection. And as you can see on the screen here, gay and bisexual men are not the only people deferred under this policy from donating blood. Now, I mentioned earlier that this initial deferral policy was put in place back in 1983 when HIV testing was either scarce or non-existent. Now, you may be wondering why it remains in place at all, given the advances in HIV testing in the years since. And the answer is that there is still a small risk that HIV is present in someone's blood before it shows up on a test result, meaning there's a small risk that HIV and other diseases could be transmitted during that window period between infection and the test result, which is why the committee that advises the FDA on these matters has approved the continuation of deferral policies. Now, there have been changes in the years since. Most notably in 2015, the FDA shortened that permanent deferral and made it a 12-month deferral for men who have sex with other men. And that was really in response to comprehensive testing and data that showed that such a change would not negatively impact the safety of our blood supply. And I'll note that ABC supported changing the deferral policy to 12 months as far back as 2000 because we understood that it would not increase the risk of HIV infection in our nation's blood supply. The change was made again during the COVID-19 pandemic in response not only to the pandemic and the strain that it put on our nation's blood supply, but also in response to the science, which showed that moving from that 12-month deferral to a 3-month deferral for men who have sex with other men would not put at risk our nation's blood supply. And so this change followed the science, and it was a change that ABC supported. Now you'll notice that the FDA's deferral policy is a blanket deferral, meaning that if you're a man who has sex with another man, you're deferred from donating blood. It does not take into account someone's individual risk behavior. It's based on their sexual orientation instead. Now, many organizations, including ABC, want to see a change made that bases deferrals on someone's individual risk and not their sexual orientation. To see if these changes can be made, there's a pilot study being funded by the FDA that's underway right now. It's called the ADVANCE study. There's 3 blood collection organizations, including 2 ABC member centers, One Blood and Vitalant, that's working with LGBT community centers and organizations in 8 locations across the country, enrolling participants to give FDA the data it needs to see if changes can be made on this policy to further make it a policy that is based on individual risk instead of someone's sexual orientation. And we're actually at a critical time in this study because enrollment concluded at the end of September of this year. Researchers are hoping to conclude their work by the end of this year, at which point all the information in the data will be sent to the FDA and they will decide next steps. And that could be everything from deciding a change is appropriate based on the science to wanting to get more data. And ABC's position remains the same. We want to follow the science as we seek to establish a donor screening process that's based on individual risk behaviors and not sexual or gender identity. And we support a safe and available blood supply that treats all potential donors with fairness, equality, and respect. And as we conclude here today, we want to thank all of you who support blood donation. Whether you donate yourself or you support the local drives happening in your community, you are helping save lives. Every 2 seconds in America, someone needs a blood transfusion. And the decisions you're making today are helping give someone else their tomorrow. So we invite you to learn more about the ADVANCE study at advancedstudy.org. You can learn more about America's blood centers, including finding your local community blood center to donate blood or learn more at americasblood.org. Thank you.